And now in this crunch period of stress and the poor lifestyle, people are like, well, what am I supposed to do? Can you maybe take us there so that there's some inspiration plus the education for our listeners?
Sure, absolutely. And maybe I can talk a little bit about how we work at our clinic right now,
Sure.
and that might give some perspective.
Sure.
So usually initial intake, we actually spend an hour with a patient. So that's quite a bit different in regular conventional medicine, where patients are usually in and out in 10 minutes. So it's really difficult to get even the proper information in a 10-minute visit. So we spend a full hour doing a full history and physical. And that's really important to get information from patients, all aspects of their life. And we run a blood panel, just like we've been talking about, with multiple, nutrient levels, vitamin D included, of course, hormone levels. And it really depends on what the patient needs. And I think that's the thing too. It's very personalized based on their history and physical. And then bring them up for a follow-up, and we review the blood work. And then the program that we start obviously is based on what their needs are. Now, my specialty at our clinic is actually in hormone therapy. So thyroid and menopause and PMS and those sorts of things. So that's the role that I play at the clinic. And what's interesting is, I use what's called bioidentical hormones if a patient needs hormones at all. And if they do and they're suffering and I prescribe them, I'm going to prescribe hormones that are the same structure as what the body produces, so that we don't get those downstream side effects and risks that you would see with, say, a hormone that has all those side chains and can cause a lot more side effects. But what I'm finding, what's interesting, is that when we look at the whole person, and I work with a team of people at our clinic, including naturopaths, is often if you can look at what's causing the hormone imbalance in the first place, for instance, it might be poor diet or toxicity or stress. And if you look at that and deal with that in various ways, sometimes those patients don't even need the hormones. They don't even get to that point. So it's interesting. I'm prescribing a lot less hormones now, even bioidentical, than before. But that's not to say that we don't give them to people, because people are suffering and you still have to treat their symptoms right now. But speaking of transformations, there are, we get calls all the time where people are like, I think people forget what it's like to feel well. And they're just used to feeling achy or not being able to move very well as they get older, or not sleeping well. And then when those symptoms go away, they're less achy, they have more energy, they're bright in the morning, they're not depressed.
Yeah.
Then it's like, oh, this is what health is and well-being.
Well, most people don't feel it. Like we saw in our program, that what we would do we would say exactly 1 hour intake with the blood panel, team of practitioners in nutrition, fitness, mindfulness, psychology. And we had a questionnaire, extensive questionnaire at the beginning, and then we did a questionnaire at the end again, all around health and well-being. And the questionnaire at the beginning, one of the questions was, on a scale of 1 to 10, how well do you feel on average? More than 70% of people were less than 5. They're feeling and you have to make them think, because people think, we've been told, the society has told us, you're getting older and you're 40, and that just because you're 40 and over now, it's normal to feel aches and pains and low energy and depressed and low libido and cholesterol being high and then the blood pressure and then and then the medications just get added and added and added until you have your heart attack, stroke, mental breakdown, and or cancer. Right? By the time and that's all been normalized. So people were like, majority were under a 5. And then at the end of the program, Carolyn, over 80% of people, their health and well-being, they would rate it as a 7 or 8 out of 10. So we had shifted, you can shift people, but they didn't even remember. So in our note taking, I'm sure you do, I would write down all the horrific stuff. What's your energy level? They'd come in 2 out of 10. What's your libido? 2 out of 10, 10 being good, right? What's your mood? 2 out of 10 or 3 or 4 out of 10. And then invariably within a month, 2 months, you're fixing their diet, you're adding the vitamin D, you're adding the B12, right? You're looking at them moving a bit more, sleeping better, getting rid of, watching the news, all those things. And then all these things would shift and shift and shift and shift until they were like a completely different person, or, their real self, they're who they were meant to be. But people don't know that they can do that. So we're telling them, you can do this. This is what you can do.
Yes. And I think those questionnaires are so important, because we do the same thing at our clinic, because people forget too how bad they used to feel.
Yeah.
So sometimes we have to pull up the questionnaires and say, well, look what you came in with, and look where you are now. And they're like, oh my goodness, that's right. Yeah. I'm even more better than I thought. So it's encouraging. But again, it's not just the doctor. I think that's the thing we have to emphasize is I feel like, we can be the educator and the traffic director and recommend, but that patient needs to be motivated and willing to get well. And I do find that more and more of that is coming from patients, that they're asking for that. They don't just want that pill for the symptom.
What percentage of people would you say that come to you because they're so appreciative and grateful? I'm channeling the answer of obviously, but don't you find it's the majority that listen? It's not like they're not motivated and they won't listen.
Absolutely.
They've just never had the direction.
That's right. Because I'm not doing general family practice anymore. So my group is a very selective group of people. Those are people who have moved, sort of saying, I'm not getting the answers with all these medications, pills, whatever it was, and I'm looking for another way. I want to get to the root cause of my problem. And they come searching, right? But that's the thing. And I know you wanted to talk about this a little bit, is the cost, right?
Yes.
We want to be available to everyone, but right now this type of medicine is not available to everyone. And the naturopaths I work with, some people do have coverage for naturopaths, which is fantastic. But for a functional medicine physician, there's not a lot of routes patients can go. But I do believe in the United States, more and more insurance companies, third-party companies are starting to cover functional medicine, preventative medicine treatment, because they know in the long run, they're going to probably save money.
Not probably, 100,000%, they're going to save trillions. Yeah. It's a lot of money. And this is the thing, is that we're not, for doctors to go down this road, this route, who really want to help their people access their potential and get healthier, they have to invest all this time and money that's not supported, because we don't learn this in med school generally. And then when they come to give this to people, no one's funding it. So now you're stuck in the situation where you're having to charge for it. And this is what the show is about right now, this movement that we're going. And our work is connecting to people out there and saying, it's time right now that we support physicians who've taken the oath and want to support health and well-being and human potential, to be able to be supported to get that right education. And then it's time that we support the public to have access to this education and this guidance at little to no cost, especially in somewhere like Canada, where our taxes are significant and we're throwing, hundreds of billions of dollars every year into the treatment of medical disease, which 80% is preventable. We might as well put it into helping people never need that intervention and get healthier. Because if I were to ask you right now, Carolyn, how many cases of high blood pressure or cholesterol or diabetes or depression or pain have you reversed? How many would you tell me? How many?
Well, there's a lot. Let me use hypertension or high blood pressure as an example. So in the last year, I would say there are 4 to 5 cases, because I don't actually see myself personally a lot of people with high blood pressure, but I have had 5 patients in the last year that are now completely off their blood pressure medication. And one of them was on 2 or 3 blood pressure medications. His blood pressure was actually not that well controlled, even on the medication. And every one of them now, their blood pressure is better controlled than it's ever been before.
And how old? Sorry, how old was he? How old was he?
He's about 55, actually, but he's been on blood pressure medication for years. And I'll give you another example. My mother, who is 82, was on blood pressure medication for over 25 years. Her mother had high blood pressure. It runs in the family. 2 years ago, we took her off and used various nutrients, lifestyle, that sort of thing. Her blood pressure is now the best it has ever been and completely stable. So it just shows you it can be done. And the same thing with diabetics. You know, we're told that, oh, once patients are on medication, they can never come off that medication.
That's not true.
But that's not true.
No.
That's not true. No. We can change that gene expression with doing things environmentally.
So what did you do with just so that everyone hears, what was the approach you took with a gentleman with the high blood pressure? Because that is something everyone that comes in, whether they're in their 40s, 50s, or in their 20s, 30s with antidepressant, anti-anxiety medication, somehow the message has been given to them that they will be on those for life. And like I said before, as the decades or the years or every 5 years gets added, because we're not doing anything to support this education of lifestyle and this empowerment, the medications just get added and added, so that by the time you're in your 60s or 70s, you're on a whole concoction of 10, 15, which each of them have, now we learn later, have huge side effects. You know, the cholesterol medication increases your blood sugar, right? The antidepressant makes you overweight. So then, or anti-anxiety makes you overweight. So now you're dealing with diabetes and high cholesterol and it's just,
I think if you don't do the dietary changes, and if you have huge stressful things going in your life or relationship issues and those aren't being dealt with, then obviously you're not going to necessarily get the results. I don't want to ever think that, just giving a supplement is going to turn someone around. I think it has to be all encompassing,
exactly,
right?
Yeah. Which you can't get with a pill, which you can't get with a blood pressure pill. You can't address the relationship issues that are causing your nervous, right? Yeah.
Absolutely. And I just want to touch on, you mentioned magnesium. And I think if I could talk about a second nutrient that's really important, that's, involved in numerous biochemical reactions, and that's magnesium. And the problem is that we don't have magnesium so much in our food like we used to. And I think that's an important point to people to say, well, why do I have to take these supplements? Well, maybe 50 years ago when we got the food out of our grandmother's garden, we didn't have to. But now we know our food is so depleted in vitamins and minerals because of over farming and pesticides that we do need vitamins and minerals, especially minerals. And if we don't have those minerals, I think it's 60 you need every day, you can't even absorb a vitamin. And I've started testing magnesium levels. Now, if you just test magnesium, it's generally going to come back normal in the blood because our body regulates calcium and magnesium. But if you test RBC, which is red blood cell magnesium inside the cell, that's when you're going to start to see the deficiencies.
Oh, I haven't done that before.
But again, that's not covered by OHIP. So patients have to pay for it. And sometimes that can be an issue.
OHIP is our Ontario Health Insurance Plan. So in Ontario, that's what's covered for the blood testing, and also the payer for the physicians for our visits with patients.
Yes.
So how much is it actually? I'm curious. I've never done that.
I think it's about $40 approximately.
Like vitamin D. Yeah. So in your program, you said you have the naturopath yourself. Is there anybody else that people see?
Yes. So we have actually 3 naturopaths. We have our herbalist, a colonic therapist, a osteopath, and a registered dietitian.
And then do people have, with your visits, do they have to pay for it to see you?
They do, yes.
Yeah.
So because it's through the college, it's called alternative and complementary medicine section.
Yeah.
It's not covered by OHIP. Occasionally, if I see someone, say, just for a short visit and we're just looking at thyroid, then that would be more of an OHIP visit.
Yeah.
But the majority of stuff that I do, because it involves a lot of other modalities outside of conventional medicine, then it's private.
And then they have to still pay for, those visits if they don't have insurance. And that's the challenge right now to our listeners. And everyone's out there, you're connected, you have funding, you have ideas, you have money. There are physicians like myself, like Carolyn, all over the world who have been practicing in silos, right? Have gone down this path at a lot of challenge, personal challenge and risk to do the right thing by our oath and by wanting to help people get to their health and well-being. And we've all been separated. And now is the time to come and bring this knowledge of decades and decades that we know works so that we can support the vision is, support the physicians to get trained, and support the masses to have access to this at minimal to no cost.
Absolutely.
Right? Because that's a win-win for everybody.